Sleep is sometimes something that's just associated with, we've got a diagnosis of epilepsy for ourselves or for our child, and so we just expect that there's going to be sleep issues associated with that. But actually we know from other populations, typically developing individuals and other sort of clinical populations, so ADHD, autism, that you could improve sleep, and that actually has a knock-on impact in improving a range of other outcomes.
Fellow Homo sapiens, my name is Tori Robinson and welcome back to Epilepsy Sparks Insights. If you're new or you haven't done so already, please do like and comment on the episode and subscribe to our channel so to support our mission to decrease the discrimination faced by and improve the quality of life of those affected by the epilepsies, and indeed to get everybody appreciating the amazing epilepsy research out there. So sleep and epilepsy are totally interlinked, not just in the way that sleep disturbances/disorders can cause seizures and impact quality of life, but that people with an epilepsy are more likely to actually have a sleep disorder anyway. Today, we are going to hear in part 1 of 2 with research fellow Georgia Cook why effective communication with lay people in epilepsy research can be a challenge, how the way that patients and families think and prioritise can be different to that of the researchers, the vicious cycle between sleep disruption and epileptic seizures, the impacts of COVID upon epilepsy research, and why clinicians, neurologists, epileptologists and epilepsy nurses must pay attention to sleep in people with an epilepsy.
My name's Dr. Georgia Cook. I'm a research fellow based at Oxford Brookes University. I am an academic and a researcher, so I predominantly do research with children, young people and families, as well as healthcare professionals looking to improve health and wellbeing outcomes for individuals and children, parents, families.
Psychology and psychiatry are involved in every single study, I think, in every part of life, so it's brilliant to have you here. But you've been involved in the epilepsy side of things, so tell us about that.
So I'm actually a sleep researcher by background, but I actually got involved in the Castle study. So the sort of formal long title is Changing Agendas on Sleep Treatment and Learning in Epilepsy. This was a large NIHR funded study that was led by Professor Deb Pal and Professor Paul Gringrass, that was aimed to improve sleep in children and young people with epilepsy as well as their parents, and also look to improve sort of wider health and wellbeing outcomes in children, young people and their families.
And so we thought of the title of this episode as Epilepsy and the Tightrope of Communication. Tell us about that. Why is it a tightrope?
Well, it's come sort of I've developed my knowledge and understanding about the tightrope of communication through actually speaking to children, speaking to parents that we've done sort of extensively as part of the Castle trial. And from the research we've done and from speaking to families, what we found out is it's a real challenge. And actually there's real issues in communication, understanding, but it's a really, really important topic and something that is of real importance to children, young people and their parents. From the research that we've done, we know sleep problems are really prevalent, and we know that from the wider literature as well. Children with epilepsy, sleep problems is a really a common issue. It's also something
same in adults.
Well, absolutely, it's an issue for all of us in the general population.
Well, yeah. Put your phone down. Yeah.
Exactly. Put your phone down, have a good routine around sleep. And the nice thing with sleep is it is a modifiable target. We can change sleep. It's a behaviour and we can improve things. What we've heard from lots of families is that sleep is sometimes something that's just associated with, we've got a diagnosis of epilepsy for ourselves or for our child. And so we just expect that there's going to be sleep issues associated with that. But actually we know from other populations, typically developing individuals and other sort of clinical populations, so ADHD, autism, that you could improve sleep. And that actually has a knock-on impact in improving a range of other outcomes, as, we all know what it's like when you have a rubbish night's sleep.
I totally relate. Do you know what, when I was growing up, I just couldn't get sleep. I had a real problem and problems with nightmares. Even as an adult, you just get on with it. And then but if you're lucky enough to find a clinician or bump into the right person who can give you the right tip, simple things I think can make a massive difference into quality of sleep and therefore with epilepsy, even sometimes reduce seizure frequency, severity and improve overall quality of life. So I know you haven't published the paper yet, but have you found out things like that so far?
So that was absolutely sort of the principle that started this trial, is that we know that there is this sort of vicious cycle between sleep disruption and for those with epilepsy, as you rightly point out, it can have a really negative impact on their sort of seizure control or seizure thresholds. So what we wanted to do was see that if we can improve sleep, and yes, we have found from the trial that we can improve some aspects of children's sleep through a sleep intervention. So that's strategies that are specifically aimed at improving sleep.
What were some of the challenges in this study? Although we may want to kind of achieve similar things, that is improving the quality of life of the children and families, we come at things from different angles. And by we, I mean families, individuals, clinicians, researchers. What were the challenges?
So one of the things that we did specifically in this trial was involve parents and children from the outset in sort of patient and public involvement. That sort of main strand was led by Professor Lucy Bray at Edge Hill University. And that was so valuable in directing and guiding and shaping sort of what we did and why we did it and how we did it. So how we collected the data, what we sought to do. One of the challenges is obviously the variability in terms of sort of epilepsy syndrome and epilepsy sort of symptoms, seizure severity and frequency. So we really tried to focus on a sort of specific group so that we had a group that was as similar as possible. But as with any sort of clinical trial, recruiting families can always be a real challenge. So getting people to take part, because obviously, you're already trying to live your normal everyday life. Fitting in, taking part in research can be really, really challenging. And I suppose one of the things that we learn is the importance of kind of balancing what as researchers and academics we might like to include and what is sort of essential to include to allow us to get the data to answer the questions that we've set out to achieve, but without putting a huge sort of additional burden on participants.
So tell us about some of the feedback that you got from all parties in regards to, because this study was about 6 years in length, is that right?
Yeah, absolutely. So this was a big trial, and actually COVID had a big impact on this trial. We actually sort of amended the trial to be a completely remote trial so that participants were recruited through their epilepsy clinics. And then were able to take part in all aspects of the trial sort of remotely to try and reduce the burden and reflect how care changed as a result of COVID.
Wasn't it kind of a opportunity in a way, because lots of people's sleep was mucked up as a result of COVID and the lack of routine and things like that. So was that kind of, I mean, it sounds a bit sick, but kind of like a benefit of working over COVID?
Yeah, it's an interesting question. So we ended up actually sort of redesigning the study over COVID, and we didn't start collecting data until we were sort of out the other end. Some of the early data collection was while there were still various sort of restrictions in different locations and in different places. And so absolutely, it was a way that allowed us to continue collecting data when I know a lot of trials stopped and really struggled because of the restrictions and not being able to see sort of patients in clinic face to face or in person as they might have done beforehand.
What were the negative aspects of that, of everything being remote?
So I think that brings with it a whole host of sort of additional challenges. I think the need to be really clear and have really good guidance for participants who are taking part, what's actually involved, what do we need them to do and how do they do it? Making sure we had someone available, that was me in this particular trial in a lot of instances, to the families to answer any questions that they had, to help sort of guide them through various processes. So we worked really closely with our advisory panel to produce guidance and make sure that everything was sort of explicit and clear for families to make it as easy as possible for them.
What was the issues with communication? I mean, you have touched on it a bit because of everything being remote, at least at first. But were there lingo aspects? Was it cultural aspects? What did you learn?
So what we learn is that parents and children really like to have a person. I think that's really important to mention, and I think that's not surprising. I think any of us taking part in sort of a trial would feel the same. They want to have that sort of social or sort of peer support as well. That was really important, to having access to other individuals with epilepsy. So it's not just sort of healthcare professionals, academics, researchers. I think what did come out kind of beyond the trial itself was that communication between healthcare professionals and individuals with epilepsy, whether it's children or adults, and the sort of families and caregivers, is so crucial. And although that sort of wasn't one of the direct aims of this trial, which was looking to improve sleep, it's something that actually came up in a number of the strands of research that we did as part of this bigger sort of program of research. So what really came across strongly to us is that people want to be able to have a sort of open, transparent line of communication, particularly with the healthcare professional, but also with sort of academics and researchers if you're taking part in research. And I think, in the current medical context or sort of healthcare context, we know that resources are scarce. And I think what came out really strongly to us is that families don't expect healthcare professionals or academics to have the answer to every single question that they might have. But what's really, really important, and this came out from our advisory panel through some of the research we did and my work, just anecdotally speaking to parents as being the person at the end of the phone, was, that need to feel listened to. And I think that's really, really crucial, to be able to feel that you can talk about whatever topic is important to you. And in this trial, sleep is something that the children recognised was an issue for them. Many of the parents recognised was an issue for their child, which also had a knock-on impact on parents' sleep. But actually, it was a topic that many individuals didn't feel they'd had help or support, or had even been sort of mentioned in clinical consultations previously, but was something that impacted on pretty much every aspect of their daily lives and that sort of their well-being. We mentioned earlier about the impact of poor sleep. We all can recognise, I'm sure. And I think that's just compounded when sleep can then have an impact on your medical condition.
Yeah, we've said before on potentially seizure, the impact on seizure frequency severity, but also it's not just about seizures, right? It's about mental health. It's about other aspects of the individual's health and the family's health as well. I think that's really important to put that out there. Again, epilepsy is not just about seizures.
Oh, I completely agree. And this is absolutely what we were told, is that, sometimes in these clinical consultations, there can be a real focus on sort of the medicalisation or the medical aspects. And actually that means that, sometimes some of those other things that are even more important to families and to individuals with epilepsy, be it children or adults, the impact it can have on mental health, the impact it can have on performance, the impact it can have on your emotional and psychological well-being is really, really pronounced. And we know that sort of across the board, any research that I've been involved in where we're looking at sleep, whether it's in the general population, whether it's in children, whether it's in adults, whether it's in particular clinical groups, sleep can impact pretty much every aspect of our lives. And so it's a really important topic that we should be talking about, and actually it isn't talked about as much as we would like. And I think one of the real challenges as a sleep researcher is that because sleep impacts everything, it actually doesn't always fit neatly in a box. Funders who fund research, or sort of academics who work on particular or healthcare professionals who focus on a particular aspect. So when you come to a consultation with a healthcare professional, they're probably going to focus on seizure severity and frequency, etc. And that is absolutely really crucial. But sometimes that's not the priority for individuals or their caregivers.
Well, and indeed, especially because if you are one of those clinicians who unfortunately just focus on seizure frequency severity, if you miss out things like sleep, you are missing out on identifying potential triggers or impacts on a person's likelihood of having seizures. So it's just a bit silly, I think, to exclude all of those things.
I completely agree. I think one really interesting finding that came out of a particular sort of strand of research that we did as part of this programme was we did a survey of healthcare professionals who work with children, young people and parents. And one of the real sort of challenges and issues that I think may explain why some people are not bringing up sleep as much as they could is that actually some of the professionals don't feel very knowledgeable. They don't feel particularly confident, and they don't feel necessarily that they've got the answers that people might want around sleep. And so sometimes, and I think, again, I can totally understand, we've all been there, you don't want to admit, I don't know, or I can't help with this issue. So what we find is that sometimes then people avoid the topic because they think, oh, well, actually, I can't really help with that, or I don't really know what to do, or I don't know where I would direct families, because the resources available, the information to kind of help around this topic, or sleep clinics, there are sleep clinics in some parts of the country, but as with many services, they've got huge waiting lists. And, they're not available to lots of areas or to lots of individuals. And so I think there's sort of a multitude of issues here. You know, if you've got healthcare professionals who are not feeling knowledgeable or confident, but you've got families who they have an issue they really feel they need to talk about, that's a challenge. But equally, I think sleep is something that isn't necessarily always acknowledged as playing a role. People don't necessarily know that they should or could bring up sleep as a topic in these consultations.
I think so completely, especially so from the clinician point of view. If you're not a epileptologist, you might not be familiar with the relationship between it. And honestly, you could be the brightest spark in the box as a person with epilepsy or a family. But if that connection isn't like put in your head, and you're too tired anyway to notice the correlation, which can be the case, right?
Yeah.
Then why would you bring it up? Thank you so much to Georgia for showing such empathy for individuals and families affected by the epilepsies, and the researchers and clinicians, and for sharing with us what she has learned in the Castle study, which benefits all of the aforementioned parties. To learn more about effective epilepsy research, PPI, get ready for episode 2 with Georgia next week, where we will be talking about the benefits of clinicians saying, "I don't know," to patients and families, the challenges of and positive impacts of positive effective communication upon patient and family quality of life, finding the time for effective communication between patient and clinician, and the importance of qualitative research engagement and how it complements quantitative research. We'll also hear about strategies to improve patient communication in an epilepsy trial. Check out more about Georgia and her research on the website toryrobinson.com, where you can also access the podcast, the video and the transcription of this episode all in one place. And if you haven't already, don't forget to like, comment and subscribe to the channel, and share this episode with your friends, your colleagues, your family members, universities and schools, because this supports our mission to decrease the discrimination faced by and improve the quality of life of those affected by the epilepsies. And it gets everyone appreciating the incredibly cool, valuable epilepsy research out there. See you next week.